Delaying Medicare enrollment working past 65. Turning 65, still working and have a healthcare coverage through employer? Do you have to tell Medicare you want to delay enrollment? Yes, if you can delay enrollment, you need to let Medicare know. But first, you need to check with your employer if you're required to take Medicare at 65. You may have to, especially if your company has 20 or fewer employees. Not required to do Medicare? What's next? You need to make sure your employer coverage is creditable. That means as good as Medicare would provide. Ask your plan benefits manager for a written notice of creditable coverage. Why do you have to do this? Because providing proof of creditable coverage allows you to enroll with Medicare later without late enrollment penalties. So when to enroll? You will have a special enrollment period when the employer coverage ends. It lasts 8 months. You'll be able to enroll in Parts A and or Part B and then choose additional coverage if you want it. But be careful, you only have the first 2 months of this period to get drug coverage through a Medicare Advantage plan or Part D prescription drug plan without penalty. What else should you know? You can consider enrolling in Medicare Part A while keeping the employer coverage. Part A provides additional hospital coverage and is usually premium-free. What about Part B? Do you have to get that too? If you have a qualified insurance through your employer, you may be able to delay enrolling in Part B and Part D without penalty. Want to get Part A even though you're still planning to work? Do you have to enroll? You will need to enroll in Medicare yourself unless you are currently getting Social Security benefits or Railroad Retirement Board benefits. Where can you learn more about your options in the special enrollment period? Learn more about enrolling in Medicare when working past 65 at health plans in Oregon.